Hello, everybody. Making another video today. It's Monday. Today's Monday, December the 11th, and been getting a lot of really great comments on the previous videos that I've done. I've noticed some of the videos get a lot more views than some of the other ones do. Seems like the ones where I talk about what I've been through and with the like symptoms that I had before going into the hospital, or what it was like, or what it is like being an alcoholic, things of that nature seem to be getting some of the most views. But what I wanted to make a video about today is kind of controversial, but I really think it needs to be discussed. This is something that's really near and dear to my heart, because I've encountered this so many times. It's been, every time I've been to the hospital almost. I would say every time I've been to the hospital, I've encountered this problem every time. And I don't want anybody to get offended. Please don't. I'm not saying that everyone in the healthcare industry does what I'm going to talk about, but it is an issue, and it does come up, and it does occur, and it's unfortunate. But like I said, it's something that needs to be discussed, and I haven't seen anybody talking about this anywhere. So that's why I decided to talk about it today. This is something that I've dealt with over and over again, and it's really got underneath my skin. I'm a pretty relaxed guy. I do have a temper just like everybody else does. When I used to drink, I used to be a lot more wishy-washy as far as my feelings are concerned and stuff like that. It was really hard when I would get angry to contain my anger and things like that. And now that I don't drink anymore, I would say that I'm a little bit more even keel. I still get angry about things every once in a while, get upset about stuff, but as far as on a daily basis getting upset about things, I just don't really get too worked up about stuff anymore. But this is one of the topics that does really get underneath my skin, and has upset me multiple times. So the topic for today is, how do alcoholics get treated in the hospital, or get treated when you go to the doctor or any other healthcare professionals or anything like that. I have not had some of the greatest experiences when I've been in the hospital. There's already, when the nurses come in, they look at your chart. There's already a preconceived notion already the moment they looked at your chart, and they already know that if you're in there for pancreatitis, that you're in there for alcoholic pancreatitis or alcoholic induced pancreatitis, or either if you're in the hospital for alcohol induced liver disease. The nurses, they look at that, and automatically in their head they're going, this guy's an addict, and if he or she needs pain medicine or whatever, they're automatically doing that because they're an addict and they're looking to get high. Now, that might happen, and I'm sure that there are people that go into the hospital all the time, that are seeking pain medicine. And that's kind of ruined it for people when they really are in need, because everybody in that industry, and I'm sorry, let me rephrase that, not everyone, but most in the industry, already have this idea that people like us are seeking pain medicine, and wanting to get high. For me, I don't like going to the hospital. I'm sure most of you don't like going there either. I mean, the food's not any good. You're not at your home. You're already uncomfortable. Your bed isn't the greatest. You have this little 13-inch television that you're watching. You've got IVs hanging out all over your body. just getting up and going to the bathroom, you have to unplug the IV machine, and then you have to wheel that into the bathroom, and it's just a pain in the butt when you're in the hospital. I can't stand being there. And I would imagine that most of you don't like being in the hospital either when you go. I mean, it's just not a great experience, but I mean, it's needed. And when you're in the middle of pancreatitis, or you're having some, problems with your liver disease, and you're having complications, that you have to go to the hospital, and that's just one of the things that we have to do. But once again, back to the subject, when you go in the hospital, automatically you start getting these looks, and they start asking you questions about why are you in the hospital, what's going on. And, I'm pretty open about it. I just tell them I'm in here because, I used to be a really bad alcoholic. I mean, I guess I still am an alcoholic, but, that just doesn't drink anymore. But, they've already got this, idea in their head, like, yeah, this guy's an alcoholic. He caused this to himself, and now he's here, and he just wants to get pain medicine so that he can get high again, which is not the case. Like, for me, my liver specialist and my GI doctor and everybody, I'm only allowed to take 2,000 milligrams of acetaminophen every day, and that's 4 extra strength Tylenol. So I have like a 12-hour window of pain relief that I can take. I'm not allowed to take ibuprofen, aspirin, anything else. All I'm allowed to do is take Tylenol, and I'm allowed to take 2,000 milligrams of that a day. That's it, or 2 grams. That's all I'm allowed. I would prefer to take ibuprofen, because ibuprofen works really well, but I can't due to my stomach bleeding issues. I wish I could, but I can't. And when I'm in the hospital, especially when I'm in there with pancreas problems, I'm in a lot of pain, and I'm sure a lot of you can, agree with me on this, that, pancreatitis is a very painful condition to go through. And whenever you ask for, pain medicine or something like that, because, you're really hurting and you want some comfort. And, the first thing that you get is, a whole slew of questions. How much pain are you in? Give me a scale 1 to 10. And then you tell them, and the next thing you know, they want to come in, they want to check your blood pressure and do all your vitals. And I remember one time I was in the hospital, and it was late at night, and I'd already been having a bunch of issues with the pain medicine. The nurses were just giving me a hard time the whole time. And it had been like 6 hours since I had had any pain medicine. I was hurting really bad. It was pretty late at night. It was like 10 or 11 o'clock at night, somewhere around there. And the nurses, they have, basically 2 shifts. They have a day and a night shift, and most of the time they work on a 12-hour shift. So it's like 7 to 7 and 7 to 7. So they, the day nurses come in at 7 in the morning, and they leave at 7 o'clock at night. And then they bring in the night nurses, come at 7 o'clock at night, and they leave at 7 o'clock in the morning. And depending on how, swamped they are, the nurses might have anywhere from 4 to maybe 10 patients. I'm not really sure. My family are, a bunch of my family are nurses and, are in the healthcare profession. So they come in and, in the morning shift, they'll come in, they'll walk in with the night nurse. The night nurse will introduce them, if you're lucky. Sometimes it doesn't happen, but they'll bring in the day nurse and introduce you to them, and they'll go over your chart with them and all that good stuff. And then you've got to, wait until they, come around. They have to get with all their other patients, and sometimes you might be the last patient. So, you might have met that day nurse at 7 a.m. in the morning, and you won't see them again till 10, 11 o'clock again. And that's right around the time that the doctors start doing their rounds. And, from, let's say, like 9 o'clock in the morning until about noon, your room is just, full of people coming in, especially if you're at a teaching hospital. You'll have the nurse, and then you have the other nurse, and then you have the hospitalists come in, and then you have your specialists come in, and most of the time when they come in, they bring students in with them. So you might have a doctor with 10 other students that walk in the room with them. You've got all these people standing around your bed, which is already uncomfortable enough. You got people wanting to touch you and like feel on your stomach. Students want to do the same. So it's already kind of intimidating. You got all these people wanting to come in and talk to you, and you just want to be comfortable. And I remember this one time the nurse had come in on the night shift. The day nurse had introduced her, and I told her, I said, hey, whenever you get a chance, can you come back in the room and give me some more pain medicine? My stomach and my back are hurting me really bad, and I haven't had any in quite some time. And she said, yeah, I'll be back whenever I get a chance. And I'm like, okay. So I waited and waited and waited, and eventually got to about 10 or 11 o'clock at night. I don't remember which one. But when she came in the room, she had I can't remember what they're called, the people that come in and do your vitals. But she had that girl come in the room, take my vitals, and then she was taking a look at them, and she goes, I'm sorry, sir, but your vitals don't indicate that you're in enough pain for me to give you any pain medicine. And I'm like, what are you talking about? How in the world can you decipher what kind of pain I'm in due to my vitals? She's like, well, your blood pressure's not high enough. And I'm like, but ma'am, I'm on blood pressure medication. Like, my blood pressure is always low. And I mean, my blood pressure is like low now. It used to be really high, but now it's consistently low all the time. And she refused to give me any pain medicine. And I'm telling her, I'm like, ma'am, please, I'm in a lot of pain. And she told me no. And the whole night I went without. I think she came back in at like 3 o'clock in the morning at some point and decided to give me some pain medicine. And that was all I got for the entire night. And I suffered the whole entire night dealing with that. Next morning, when the hospitalist came in, I made sure to let the hospitalist know, because they're the ones that prescribed the pain medicine for me. And the nurse refused to administer it to me, which is not her call. You have a doctor that says, this is what we're going to give you every so many hours, and then we'll give you this for breakthrough pain. And then they just refuse to give me any pain medicine at all. And that's just ridiculous. I'm not going into the hospital seeking pain medicine. I mean, that's the last thing I want to do. I'm not trying to sit in a hospital environment and get high. I mean, it just makes no sense. But maybe there are people that do those types of things, but I've never done that. Anytime I've ever been in the hospital, because I had to be there. And it's the last place I want to be. I remember one time, it was back in September of last year, when I got the second bout of pancreatitis after the first bout. And I hadn't been drinking for months, and, ended up in the hospital again. That's not where I wanted to be. I just started throwing up blood and all that stuff, and was very sick. And then next thing you know, I'm back in the hospital again. And like I said, I didn't want to be there. And that time, was, it was a problem. Now, when I was at my local hospital, they did a really good job of taking care of me. The only problem is that my local hospital just doesn't have the doctors or the equipment or the expertise to handle somebody like me. I just went to my local hospital because it was the closest. And, I was throwing up blood, red blood, and I needed to go somewhere immediately. So I went to one of those like emergency room kind of deals where they have like a separate emergency room, like a satellite emergency room that I went to. I went there, and the next thing you know, they told me I had pancreatitis, and then the ambulance came and took me to the actual hospital. And when I got there, that's when all things broke loose, and they ended up taking me to the ICU, and then I got transferred to another hospital up in Columbia. And then when I went to that hospital, I was extremely ill, very bad off. And, I was in a lot of pain. That's when I really started accumulating a lot of fluid on my stomach. And it was just really painful, and dealing with the nurses up there. Some of them were really good and some of them weren't. Some of them just, want to take it upon themselves to make the decision if you should get your pain medicine or not. And, I understand that, pain medicine is addictive and can cause problems, especially for somebody with an addictive personality. But unfortunately, there's times where it really is needed. I mean, when you're sitting there dealing with as much pain as you are with pancreatitis or, other complications that can happen, you just want to be comfortable. And, sometimes it just doesn't work out that way. There have been multiple times I've been to the hospital and just had, just problem after problem with some of the nurses, not wanting to help me. I mean, let alone just getting them into the room just to, just give me my regular medications that I have to take on a daily basis. I'm diabetic. And before I can eat, they have to take my blood sugar, which I wear a Dexcom every single day, so I can look at my blood sugar myself. But they have to, send the girls in to take your vitals, and they take your blood sugar, and then you have to wait for the nurse to come back around to administer your insulin for you, because they do it, for me based on a sliding scale. And I can't eat until I get that insulin. Then I have to wait 15 minutes before I can eat. And sometimes I'm sitting there, just starving, hungry, and I can't have anything to eat until I get my insulin. And I have to wait on them to come around to administer that. And I understand a lot of hospitals right now are short-staffed, all due to the COVID, and a lot of people left the hospitals and stuff. But still, I mean, you still are a patient, and you're still a person, and it'd be really nice to be treated like that sometimes, other than just this, well, you're just an alcoholic or an addict. And sometimes you get that feeling like they just don't care. You get this mentality, and I've sensed it so many times. It's like, you did this to yourself, so you could pay the consequences. Then it's like, I don't care that you don't feel well. You're the one that decided to drink like you did, so oh well. It's basically the feeling that I get sometimes. And it's not just me. I mean, I've been in the hospital with my mom, my wife, my dad, my brother. I've had friends come up, and they've all seen it. And they're just like, wow, this is ridiculous. Just the attitudes that you get sometimes from some. Some of the nurses are really great. So like I said, I'm not saying that all of them are like that. I've had nurses that, the doctor said, you get XYZ at, every 4 hours or whatever. And man, 4 hours on the dot, they're in the room taking care of you. And, most of the time, if I'm being taken care of, I don't bother anybody. I just stay in my room. I'm not hitting the call button. The only time I ever hit the call button is when I need some pain medicine, or, a glass of ice or whatever. And, like I said, sometimes it can be a problem. The one thing that I will say, and I'm sure some of you guys can vouch for me on this, is that when you hit that call button, it's a flip of the coin how they're going to react to you when you hit it. And I would say probably 75% of the time, when you hit the call button, the first thing you get is, what? What is it? What do you need? Instead of, just picking up, being like, hey, what can we do for you? It's just the automatic, they're probably up there thinking to themselves, here we go. He's calling back again. This guy's an addict and just wants pain medicine. Here we go again. What is it? And it's just not fair to be treated like that. I mean, like I said, I get it. There's probably people that go on there all the time seeking, but, how do they know? And if that's the case, so is everybody going to get treated the same because you have one bad apple? I just don't think that's fair. And, just because I was an alcoholic doesn't mean that I'm addicted to painkillers or anything like that. I mean, that never was my thing. I never, never dabbled into that. My drug of choice was always alcohol. And like I said, smoked a lot of pot back in the day, and and those were the things I liked. I liked pot and I liked alcohol. that I didn't really care for any other drugs. I just didn't see the point in them. And still to this day, I've never uh, like gotten a feeling from taking pain medicine anywhere near the way that I felt when I drank. It's just not the same feeling. I mean, it's just not. Um, but anyway, back to the subject. Um, there was one time that I was in the hospital and I really wanted to go home. It was the last time that I'd gotten pancreatitis back in April of this year. And like I said, I ended up at a hospital in Augusta, Georgia, a doctor's hospital, and they told me, this is a little bit beyond what we can handle here. And they sent my scans to my doctor in Charleston. And next thing you know, they told me, you need to go down there. And they pumped me up with a bunch of morphine. And my wife drove me down to Charleston because my pancreas specialist wanted to perform surgery on me. It found a blockage in my pancreatic duct. And we went down there, spent 24 hours waiting in the emergency room for them to get me a room. They were supposed to try to get that surgery done, or the ERCP done, like the next day, and I ended up waiting 4 days and to have that procedure done. And I was in a lot of pain, and they did an okay job taking care of me, with handling my pain. And then I had the procedure done, which caused a lot of pain there as well. And after the procedure, what was done was done. And at that point, I was really ready to just go home. I was tired of being in the hospital. I'd been in there for almost 2 weeks at that point, and I'd spent like a week in the hospital, or 4 days in the hospital here, and then ended up down there, waited like 4 days to have a procedure done, and they wanted to keep me around for a couple days after that. So it had been 2 weeks, and I just wanted to go home. And one of the things I discussed in one of my previous videos is that when they administer the IV pain medicine, which I was on Dilaudid, they want you to get off of that like 24 hours before they'll allow you to go home. I don't know the reasoning behind that. I don't know if they want to make sure you're not going into withdrawal or something. I'm not really sure, which is another thing I want to bring up real quick after this. I was trying to go, and one of the nurses that had been taking care of me, she had been there. She was a traveling nurse, actually. There's a lot of traveling nurses at the hospital in Charleston, and her and I didn't see eye to eye. There were some times I'd asked her for stuff, and she just wasn't being, the most compassionate with me. There were a couple times I'd asked her for some things, and I'd come out the room, to see, or I'd have my mom, walk out there to see if she could get her to come in and give me what I needed. And, I walk out there and she'd be sitting on the computer playing on her phone. And I'm not going to say I got really nasty with her, but, I did say how I felt, and told her, please, can you just take care of me? I'm not asking you for a lot, can you just come in here? And I don't think she liked me very much. I can be pretty blunt with people sometimes, and pretty straightforward, and people sometimes don't know how to take that. I just don't see any point in beating around the bush, I like to get straight to the point and just move on. I'm not the type of person to kind of dance around a subject. I just want to go ahead and get it out of the way, say what I have to say, and just move forward. And there were a couple times her and I, we didn't really have an argument, but we just, I just told her how I felt, and I didn't feel like the care was up to par and what I was expecting, and she didn't like me very much. And she knew I was trying to go home, and the doctor had already come and spoken to me that day and told me, hey, you're taking the Dilaudid. I think it was like every 4 hours or something like that. And the doctor was like, hey, you're going to have to get off of this Dilaudid for like 24 hours before we're going to let you go. And I was like, sure, no problem. Just go ahead and take it off of my medication list. I don't even want it anymore. I think they were giving me something like oxycodone in between for breakthrough pain. And I told him, I said, just go ahead and keep me on the pills. I'll take those however many hours in between, and I just want to go home. And he was like, okay, well, I'm not going to pull it off your chart yet. We're going to leave it on there in case you really need it. He's like, but try your best not to take it. And, when the nurse comes in, if she goes to give it to you, just tell her no, and we'll get you out of here tomorrow. And I was like, awesome. I just wanted to go home. I want to see my family. And I hadn't seen my kids in 2 weeks. So that afternoon, right before she left for the day, I had asked her to, I said, can you please give me some more pain medicine before you leave for the afternoon? Because I knew that if I didn't ask her for it before she left, it was probably going to be like, 10 or 11 o'clock at night before I'd get it again. And I really just wanted to get the pain medicine so I could get comfortable and try to go, I'm so sorry, so that I could just get to sleep. It's so hard to sleep in the hospital as it is already, and then when you're in a lot of pain, it's I would be up. I never sleep in the hospital. I'm up all night long most of the time because they keep coming in the room and all that kind of stuff. But she came in, and what they do is you've got your IV in, and they'll inject the Dilaudid into your IV, and then they take a syringe of saline solution and they'll flush that with that. Well, this particular nurse that I had, she had a method where she would take the Dilaudid and then suck it into the syringe with the saline solution, and that's how she used it to inject the Dilaudid into the IV. So I would never see that little glass vial or whatever it is that they push in there. And then, like I said, then they flush it through with the saline solution. And I had already been very clear with her that I didn't want any more of the Dilaudid. I just, wanted the pill form of pain medicine. So when she came in, I think it was like 6 o'clock or something like that when she finally came into the room. I'm on a lot of other medications as well. So she came in, gave me all my other medications, and then she took the saline solution. And sometimes they'll flush your line before they'll do anything else. So I'm thinking she's just going to go in there, she's going to flush my line through, and then she's going to administer the medicine. So she takes the saline solution, that little thing, and she goes in and shoots it up into my IV. Well, immediately, as soon as she did that, I felt Dilaudid, because when they give you that injection, you get a really big rush. It comes from your IV, comes all the way up. You can feel it come up. Now, this is just me, but I can feel it come up, and then it hits me right in the shoulder, and then I feel it come up into my neck. And you get this almost like cringe, kind of like your muscles tighten up, and like I said, you get this rush of warmth that comes up. And as soon as she pushed that saline solution in, I felt it, and I went, "What did you just give me?" And she said, "Oh, I gave you your pain medicine." And I looked at her and I said, "Ma'am, I told you I didn't want any more of that." She goes, "Well, you got it now, so oh well." She went about doing that and put that medicine into that saline solution so I wouldn't know what she was doing. And when she injected me, guess what? Then I had to stay even longer because I had told her I didn't want the Dilaudid, and she went ahead and gave me another injection of it anyway, without without letting me know what she was doing. So when I spoke with the doctor the next day, he was like, "Well, I see that you took the Dilaudid again. I thought you weren't going to take it." And I said, "I absolutely did not ask for that. I told her what I was looking for. She gave me the injection without my permission and just decided to do that." And I told the doctor, "I think she's messing with me. I told her she doesn't like me, blah, blah, blah." Well, anyway, I had to stay a whole nother day due to that. And the funny thing is, what I found out is that that nurse that was dealing with me, she did that to me right before she left for the day, and then she was off for the next 4 days. So she knew she wasn't going to have to see me again. She wasn't going to have to deal with me again. And that really upset me. And I'm not 100% sure, but I'm 99.9% sure that she did that vindictively to just get back at me. And, it's just uncalled for and childish, and that it just wasn't okay. It wasn't cool. But, like I said, when you get to the hospital, they're just not going to treat you all that well. I'm not saying everybody, but, you're going to get people that are going to treat you pretty bad. And I wish it wasn't like that. I wish that they would be a little more compassionate and understand, that, this is a disease, and there's a lot of people in the healthcare profession that have the same problem. I've spoken to many, many people in the healthcare profession that have the same problem. I've had doctors, I've had nurses talk to me about how I quit, and they told me in confidence, and I'm not going to say who they are or their names or anything, but I've had doctors and nurses tell me in confidence that they're alcoholics as well. And those people were pretty understanding, the ones that told me those types of things, because they were like, how did you stop? Tell me what you did, and things like that. But, there's just got to be more compassion for people like us, And just because we're in the hospital and we need pain medicine doesn't mean that we're seeking anything. We just want to be comfortable. And especially, what if this is it? What if that one visit that we're in there for, what if that's it? What if we're about to die? Can we not be comfortable before that happens? I just don't understand what the mentality that happens with these people sometimes. I guess they get jaded dealing with this on a daily basis. But, when you're in the hospital and you're that sick, you just want to be comfortable and not hurt so bad. You're already dealing with so much mentally, the depression that comes along with it, the feeling. You already know that you already messed up. You did this to yourself. You don't need people constantly reminding you that you did this to yourself and treating you like a piece of trash because you're in the hospital for drinking too much. And there's people that end up in the hospital with pancreatitis because a gallstone dropped and got stuck in their pancreatic duct, and then it caused them to have pancreatitis. Not everybody gets pancreatitis due to alcoholism. It could be genetic, and they're probably getting treated the same way. Because the first thing they think is pancreatitis, oh, they're an alcoholic, or they're an addict, or whatever it is, or they've got cirrhosis, so they're an addict or an alcoholic. Not everybody gets fatty liver. There's non-alcoholic fatty liver disease. People get that from genetics, from too much sugar, poor diet. I mean, it doesn't have to be due to alcoholism. And if you're in the hospital with pancreatitis and let's say it's genetic, do those people get treated differently than the alcoholics? I don't know. I'm just saying, I just want to bring some awareness to this. And kind of, let people know what to expect when you get to the hospital. I don't want people to go in there and be blindsided when they get in there, and then, people aren't treating them the best way. I just want people to know that, when you do go to the hospital, you're an addict or alcoholic, be prepared to be judged and for people to look at you differently. They've already got the idea that, you're an addict and you're just looking to get high while you're in there. And that's unfortunate. And for anybody that's out there that's in the healthcare profession, and you've treated people like that in the past, just think about it. Not everybody's trying to get high. We just want to be comfortable. And you never know what's going to happen to that person. I mean, they literally might not leave the hospital again. This might be it. We just make them comfortable for that little bit of time they have left while they're here, and not sit there and judge them. I mean, if somebody's got, one of the things I never understood, I asked one of my doctors one time, this is right after they had told me I had a year left to live, and I asked one of my doctors, I was in so much pain, I was so uncomfortable, and I said, please, I was already out of the hospital this time. I had just gotten out like a week before. And I said, can you please give me something for the pain? I just could not get comfortable. I was so uncomfortable. I hurt so bad. And I said, can you please give me something? He said, no, I'm not prescribing anything like that. I'm not. And when we left, I was with my wife because she had to drive me there. When we left, I looked at my wife and I said, I just don't get it. I mean, they've already told me that, I don't have much longer to go. And I understand, like I said, I understand they're addictive, but if I've got 6 months left to live, what in the world does it matter? If they're giving me pain medicine, I get addicted to it. Does it matter at that point? Is it wrong for you just to be comfortable before you die? I just want people to think about that for a minute. Really. I mean, if you get addicted to, let's say, oxycodone right before you pass away, doesn't matter, does it? I don't think so. Let's just treat people with a little bit more humanity, and think about, that they just want to be comfortable for just that little bit of time they have left while they're here. And just because they are an alcoholic or an addict, so be it. It doesn't matter at that point. But anyway, I want to talk a little bit more about this subject. I'm looking at my timer here right now. I'm already at 35 minutes, so I need to go ahead and cut this off. But thanks for watching again. I did start an Instagram page. I started a Twitter X page, and I've also started a website as well. I just went on Squarespace and started developing it. So if I'll make sure to add the link in the description. So if you want to reach out to me, hit me up on my Twitter page. You can message me on there, or you can message me on Instagram. I'm gonna get on Instagram and post up some old pictures of me. That'll be the avenue for me to post up pictures, pictures from the past, from the present. Like I said, I've got my ERCP coming up on January the 4th, and I plan on posting up some pictures of me in the hospital and this and that. So those pictures will go up there, and like I said, I will make some videos while I'm in the hospital for you guys, and talk about my experience and how much pain I'm in. You'll get to see how much pain I'm actually in. I probably will cry in the video. I'm just gonna go and warn you. I tend to, when I wake up, I'm kind of freaking out because my stomach hurts so bad. And but I want to be raw with it. I really would, want to show you, from my perspective, how I really feel after these procedures and how you might feel. So if you do see the video and I'm crying and I'm really upset, it's because that's how much pain I'm in, and I'm not afraid to show it, and I will post that. So look forward to seeing that soon. Link will be in the description for the Instagram and for the X page. And look forward to hearing from you guys. Like I said, I want to do some interviews here soon, if anybody's interested in that. But this is just a daily thing. I'm trying to build this every day. Just respond to the comments already. That takes a lot of time. But I'm dedicating myself to this right now, and I'm gonna continue to dedicate myself to this. I really want to build this channel. I want to build an opportunity for people to communicate with each other. I want to make a community, and we've already got one started already. I keep seeing the same names popping up over and over in the comment section. Hey, I really appreciate you guys. Keep coming back, keep posting. Man, you guys are so awesome, like, for real. I love all of you. Thank you so much for all the awesome comments. Thank you so much for all the kind words that you guys have said. And I never thought that this channel would be helping so many people, and I really appreciate everything that you guys bring to this channel, and all the participation that you've put in place. It's just blowing me away. It really is. So like I said, I'm just going to continue to build on this, going to continue to grow. We're gonna make this into something big, and I'm here to talk about the things that most people aren't going to talk about. The stuff that's the dark secrets, and the stuff that is just not the prettiest stuff to discuss, but it's the stuff that needs to be talked about, things that need to be said, and the awareness that needs to be brought to the table. So anyway, hey, much love, guys. I really appreciate all of you. Hey, stay tuned. Next video coming real soon. I do want to continue to talk about this subject. I probably will make another video about this and just talk about it a little bit more, because I have so many more stories to talk about. This is just basically just the icing on the cake. I haven't even gotten into the middle of it yet. Anyway, once again, love you guys. Stay tuned. Next video probably coming up tomorrow. See you then.